Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. A couple of things to make sure that you know about. The next free tour of Wellness Forum resources and health Q&A with me is April 29th at 9 p.m. Eastern. Second thing, Dr. Carol Gifford's workshop on dog and cat vaccines scheduled for May 4th, and it's going to cover from A to Z everything you need to know if you have furry children like I do, risks and benefits, vaccine mandates, multiple pet households, alternative schedules, testing for antibodies, etc. And then the next big event is this weekend, the Food Over Medicine Retreat, which I've structured around the topics that most of you want to hear about, including things like shingles and shingles vaccines. And there will be quite a bit of information about the soy controversy, which people are confused about, and bone health, and many omega-3 fatty acids, lots of discussion about that. So I've added a special session on Sunday night where there's no charge for it if you've signed up for the boot camp. We're going to put into action the things that you learn. So everybody's going to have a plan by the time you finish this boot camp. So you can still register. We still have room. So just call the office at 614-841-7700 or send me an email if you have an account on file, and we'll just charge your card and get you all set up. So I have two things I want to talk about where health news is concerned. And I'm going to start with a short piece that just supports our stance that the consumer has to be informed in order to avoid harm from significant portion of the medical profession, and that members of the medical profession have to be reeducated in order to join our team. So here's what happened. A longtime member sent me a link to a short video in which a medical doctor explains why she no longer gets or recommends mammograms. In the video, she tells us that she recommended mammograms to all of her appropriate patients, and she started getting them regularly herself at age 40. She reports that she was constantly called back for further screening because she has dense breasts, and states that this was very stressful, which I'm sure it was. After several years of this, she decided to investigate mammography, and when she did, she discovered that mammograms can cause cancer due to the radiation. The compression of the breasts between the plates can actually spread or accelerate the spread of cancer that's already there. And then she warns about the overdiagnosis rate, which is as much as a third of patients. She also reports discovering that screened and unscreened women have the same death rate after 20 years. And so these are the reasons why she no longer gets mammograms or recommends them. So the first thing I want to say is kudos to this doctor for not only changing her mind, but her willingness to say something about it publicly, because so many people are afraid of backlash or loss of respect or something of that nature. But in spite of this, there's a message for consumers and doctors in this situation. In this video, the doctor appears to be my age or maybe a little older, so she's practiced for a good long while. She followed what she was taught in medical school for decades without ever questioning it or looking into it herself. And it turned out that what she thought she knew was wrong. So if this were an isolated issue, it would be terrible based on what we know. Her bad and uninformed advice while practicing medicine for decades and telling women to get mammograms almost certainly resulted in some of the harm that she expresses concerns about in the video. But it's not an isolated issue. Wellness Forum's been warning its members about the harms of most cancer screenings for decades. And it's not just breast cancer screenings, it's almost all of them when they're used for population screening. And it's not just cancer screening, it's most drugs, procedures, supplements, and medical care in general. There are over 1.1 million doctors in the United States today, and they've all been trained to follow directions. Few have ever looked into any of what they've learned in medical school independently to verify it. And when they do investigate and discover that something they learned isn't right, like diet instead of drugs to treat coronary artery disease, they often don't look further with the idea that, gee, what else did I learn that was wrong? And they continue to recommend flu shots and colonoscopies, for example. Well, what does this mean for you? Well, the doctor or the nurse practitioner or the DO or naturopath or nurse or dietitian that you visit is not likely to give you accurate information about much or even anything. You, the consumer, will need to know better if you don't want to get hurt. In most situations, I think Americans were a whole lot better off decades ago with a lot less medical attention coming from kinder and more cautious providers. In the meantime, join Wellness Forum and get educated. And I'm back to a longtime member sent this because she knows better than to get a mammogram, but she was just happy to see somebody else saying that as well. So if you want to know better, join Wellness Forum. That's what we teach people to do, is to know better in many cases than their doctors. And of course, that's another reason why you might want to join our FOM retreat, Food Over Medicine retreat this weekend, and learn a whole lot more. So on to another topic. The second one for today has to do with supplements. I'm spending time on this issue, both in my videos and in the retreat. We're going to be discussing omega-3 supplements specifically, in addition to others, but some of the claims that have been made by at least one doctor saying that omega-3 deficiency leads to dementia. Spoiler alert, it doesn't, but we're going to talk about omega-3 and a whole lot of other things too. So what brought me to talk to you about what I want to talk about today is I recently participated in a conference during which there was a lot of conversations about supplements. I mean, a lot of conversation. Claims included that they're better than drugs, they're needed for health, they have medicinal properties, but they're better than medicine, and so on. When asked which supplements he took during a panel discussion I participated in, a very nice and I think well-intentioned doctor listed, I don't know, 3 or 4, and then said, but there are dozens more, too many to list right here. So that was alarming, and I think should be alarming. But I want to give you some perspective on supplements that might show you a different way of looking at all of this. So I'm going to start with, people tend to think that more is better, and sometimes it is. Most people think more money is better, and sometimes it is. But this isn't true with all things. While going outside in the sun is a good thing, for example, too much sunlight results in sunburn, not so good. And while humans need water to survive, drinking too much water can cause a life-threatening condition called hyponatremia, also not so good. In fact, a woman running the Boston Marathon died while running the Boston Marathon because she was drinking so much water that she ended up with hyponatremia and she died. So more is not always better, particularly when more nutrients are delivered in the form of dietary supplements. This surprises a lot of people who think that health professionals who use diet as an intervention program for treating disease must also be interested in alternative medicine, and alternative health practices often involve the recommendation of dietary supplements. But there are good reasons to question many alternative practices as well as conventional practices, particularly the recommendation to take dietary supplements. A lot of current enthusiasm about dietary supplements dates back to the discovery of diseases related to deficiency. And this began a long time ago. I mean, people suffered from conditions like scurvy and beriberi, which were caused by nutrient deficiencies, vitamin C and thiamine, respectively. While the first cases of scurvy were described by Hippocrates, it became a whole lot more common among sailors because there were limitations on how much fresh produce could be brought on naval ships. This meant that sailors went for very long periods of time without fresh fruits and vegetables, and one of the consequences of this was that many of them developed scurvy. As many as 90% of men were affected on some ships. The symptoms are horrific: muscle pain, fatigue, fever, bleeding gums, rashes, bruising, weight loss. Eventually, it causes death. In 1747, James Lind conducted an experiment to see if he could help sailors who had developed scurvy. He was inspired by Johann Bachstrom, who had noted that scurvy was due to, quote, total abstinence from fresh vegetable food and greens, and he recommended that men eat more fresh fruits and vegetables to prevent it. Lind took 12 sailors suffering with scurvy. He provided half of them with treatments which included cider, acid, seawater, and lemons. The men given lemons made a full recovery within 6 days, while the others got progressively worse. Lind's experiment showed that scurvy could be prevented and treated with citrus fruit food. The story of beriberi is quite similar and also associated with poor diet. In the case of beriberi, the most common cause is eating copious amounts of polished white rice instead of unrefined brown rice, which often results in vitamin B1 or thiamine deficiency. In 1897, Dutch physician Christian Eijkman showed that feeding unpolished rice to chickens prevented beriberi. While Edward Bright Vetter was one of the first scientists to propose the idea that food might contain substances like vitamins, he was most known for eliminating beriberi from Philippine soldiers by adding unpolished rice to their food rations. Conditions like scurvy and beriberi were clearly found to be caused by a deficiency of whole foods in the diet. Foods high in vitamin C, in the case of scurvy, are eating refined foods, polished rice instead of unpolished rice. and were historically remedied by eating whole foods. But the discovery of vitamins and other isolated nutrients in foods led to more research. And eventually, and quite unfortunately, researchers, medical professionals, and consumers became much more interested in the nutrients in foods instead of the foods in which they were found. Even more confusion was generated when scientists and nutritionists started equating the consumption of individual vitamins and nutrients with the benefits of eating whole foods that contain those nutrients. So the logic goes something like this: oranges contain vitamin C. Vitamin C prevents scurvy. This leads people to suggest that one can skip eating the oranges and just take the vitamin C pills to prevent or cure scurvy and other degenerative conditions. Confusion and misunderstanding about nutrients and foods was made worse as medical practice moved more and more toward reductionism. As doctors increasingly treated symptoms with drugs, alternative practitioners started treating symptoms with isolated nutrient supplements. As dietary patterns worsened in the westernized countries, dietary supplements were increasingly marketed instead of promoting a whole foods diet. So the conclusion from this is focus on food, not individual nutrients. And when people talk about taking nutrients to, isolated nutrient supplements to avoid deficiency, I ask them, who do you know who has scurvy? Nobody's ever met anybody with scurvy. I ask, who do you know who has beriberi? I ask doctors this. Who have you ever treated in your office who had isolated nutrient deficiencies, the real ones, right? Nobody has ever seen anybody like that. Yet, instead of focusing on diet, people focus on individual nutrients. And there is no substitute for eating whole foods with all of the nutrients all packaged up into a food product. So focus on food, not nutrients. We'll talk about that this weekend, along with a whole lot of other things. So your take-home points, first of all, I'll put this in the newsletter next week with the references and that sort of thing. I think you might like to see it so that you have that. Second thing, don't forget the free tour and Q&A with me on the 29th. Food Over Medicine Boot Camp this weekend. You don't want to miss it. And there are going to be some super special offers made to the people who are with us this weekend. So stay tuned for that. And then the third thing is Dr. Gifford's workshop on cat and dog vaccines. I've become increasingly concerned about the vaccine schedule, and Mr. Winston isn't going to have much of that. I got smart after a cat that lived with me for a long time died early for no reason. And then I started seeing this happen with people in our office. We're all animal lovers. We all adopt and rescue cats. And these domesticated cats who should have been living longer because and dogs should have been living longer because they were well taken care of and sheltered, were dying sooner with diseases like cancer, and a lot of them have autoimmune diseases and some of the same situations that we see in humans as well. So I don't think you want to miss this workshop if you love furry creatures like I do and we do at Wellness Forum. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. My email address is pampopper@msn.com if any of this stuff interests you, and I'll be back to you on Thursday with more news. Thanks for watching.